So, welcome back to Inspire Elsie's Radio. Tuned in to the last hour of my show on um, Inspire Elsie's Radio. Please contact us on 068 102494 if you have any questions or comments. And we've come to the time of the show where we have to welcome a special guest. Her name is Marge Van Dyk. So, welcome to the show, Marge, before I introduce you.
Thank you so much, Ilhaam. It's such a wonderful privilege to be with you and your listeners today.
Yes, it's World Hearing Day on the 3rd of March. And the theme this year is From Communities to Classrooms, Hearing Care for All Children. So we're going to be talking about critical issues that affect thousands of children and newborns in South Africa. And you also mentioned earlier that I've been mentioning all the time in my show that today is International Cochlear Implant Day. Um, so Marge Van Dyk is the Chief Audiologist at Tygerberg Cochlear Implant Unit. So if you can just tell us a little bit about yourself before we get into how did you get into this work and how did you get to be the chief? Wow. Such a wonderful title to have and such a wonderful career path to have.
Thank you, Ilhaam. Yeah, and I think just thank you to Michelle from the National Council for Persons with Disabilities that actually coordinated this meeting with you guys. But yeah, I got into audiology when I was just out of school. I just wanted to work with people and help people. And I think my science mind and my working with people mind just came together in this lovely field of audiology. And I've been working in the field of cochlear implants for the past 4 years. So it's such a wonderful job. And for all the young kids out there that maybe has to decide what they want to go and study, come and contact us and you can do some job shadowing. It's a wonderful, fulfilling job. So yeah, it's so wonderful to be with you on International Cochlear Implant Day.
Yes.
Amazing.
So for people who don't know, before we get into the real issue of wanting newborns to get hearing screenings, what is a cochlear implant?
Yeah, so Ilhaam, a cochlear implant is a specific device that is for people with very significant hearing loss, so moderate to profound hearing loss. If hearing traditional hearing aids don't work well for you, then a cochlear implant is something that can restore your hearing. So a surgeon needs to implant a small little wire into your cochlea, and then you need to be fitted with an external processor that will receive the sound, but then send these electrical impulses directly to your hearing nerve. So it bypasses the part with a lot of damage in your hearing organ, and it can restore hearing for people that are deaf. So it's really an incredible miracle device. It's actually, they say it's the most successful neural prosthesis that there is.
Oh, wow.
And yeah, and the first one was implanted in 1957 on today. So that's our anniversary. And we've been doing cochlear implants here in the Western Cape for 40 years. This year's our 40-year celebration. So incredible.
So cochlear implants are like glasses for the ears.
It's not just any glasses, Ilhaam, it's super glasses, exactly.
It's super glasses. So what are the benefits and what are your concerns when it comes to benefits of newborn hearing screenings, and why should they be mandatory in hospitals and not just private ones? Why should the public have access to that?
Yeah, thank you so much for giving some attention to this very important issue. So hearing loss is actually the most common birth defect worldwide. So approximately 2 to 4 children in 1,000 babies that are born with hearing loss, and it's an invisible disability. We cannot see it. It's almost like this silent epidemic. And if you think about a baby that's born, they can't tell you that they're hearing. So we often parents rely just on their responses or wait for their speech and language development, and then they're concerned. But then we've lost that very critical window where their brains are most like sponges and they can really learn to listen and talk. So doing a newborn hearing screening is really the only way that we're able to identify the presence of a hearing loss early on and then take action. And we know that if we act immediately or early, we can minimize the effect of hearing loss on their development. And many people out there might ask, what is a newborn hearing screening or how does it work? So it's really a safe and non-invasive, quite a quick and relatively cheap procedure where someone just places a probe in a baby's ear or put a headphone over. It sends signals to the into the ear, and it automatically detects if your hearing organ or your hearing nerve is responding, and it immediately gives you a refer, which say we're concerned, or a pass result. So it's a fantastic tool that we have to really identify hearing loss early.
So that would be what a screening would be like with a can you just like go through the step by step of what a screening would be and like how easy it actually is just to implement this?
Yeah. So the good thing is an audiologist or then a a trained individual would be in the hospital or in the clinic. They come around with a mobile device, so they can do it in the room with the mommies and the babies, and it's literally almost like a small earplug that
Hmm.
same as with your cell phones, earphones that gets inserted into the ear. It makes soft sounds for about 20 seconds, and then immediately the machine tells us if we get a good or bad response. So it's a very easy thing to do. It's not painful, and we get an immediate result.
So what is the current challenge for this implementation?
Yeah, very, very good question. So the issue is that newborn hearing screening is not mandated in South Africa. So it's not written into law that all babies need to get the screening, as in many other developed countries. So we have these pockets of individuals, both in the private sector, but also in government hospitals, that are running newborn hearing screening projects independently, but we are not taking hands, and therefore it's not sustainable. Funding dry up, and we have a lack of manpower. So we really need a coordinated national effort, and we need newborn hearing screening to be part of maternal and child health policies so that we can really get government funding and data infrastructure and clear pathways for referral after this screening in place. And we often think that it's better in private, but Ilham, even our private packages of care or birth packages does not include a hearing screening. So often patients on private medical aid have to pay for it out of pocket as well. So it's really, really a need in South Africa to get this mandated. And the positive thing is in the past year or so, we really have been getting good traction here in the Western Cape. We're engaging with private and public and government sectors. And like now in Tygerberg Hospital, all the babies born in Tygerberg Hospital is getting a hearing screen from the end of last year. So we are really piloting that and seeing how we can roll that out to the rest of the country. But I think parents stories are so important. Parents must know about it. They must ask for it, and they must follow up if the hearing screening was not passed.
Exactly, Marge. Where there's a demand, there will be answers. If nobody asks, or if nobody knows about the fact that you don't even get a hearing screening and that you
Mm,
need to, and that it should be a basic right for also it's for the baby's development also, which is the next generation. Um,
mm,
so I'm glad there is traction. I'm glad there's some progress because if that's happening at
mm,
Tygerberg, then it can happen at all the other public hospitals and all the clinics. And maybe one of you can
yes.
be everywhere in every community so that like we
Yeah,
can service that and make sure that our children can hear properly and
yeah.
to give them better quality of life. So, what are some of the most effective strategies for preventing childhood hearing loss and how can they be implemented?
Yeah. So actually 60% of childhood hearing loss is totally preventable. And the main culprits are often untreated chronic middle ear infections or wax buildup, or then infections like meningitis or mumps or German measles like rubella, or then just exposure to loud noises. So the strategies that we have at the moment to prevent these are immunizations against infectious diseases like rubella or meningitis. And I think especially now with that outbreak, that meningococcal meningitis outbreak in Durbanville area. I think it's so important for parents also to know if your child had meningitis, please check their hearing afterwards, because that's a risk factor for hearing loss. So vaccines, very important, but also then I think in the homes, reducing a child's exposure to tobacco, smoke, or household cooking fires. We know that that can lead to more ear infections. If the child has an ear infection, to treat that medically, taking them to the clinic, and then proper ear care, avoiding putting objects into the ear canals, and then limiting exposure to loud noises. And you might know even some toys, the sound that these toys generate are quite loud, not appropriate for children. But then if you think about our teenagers and younger children today, this digital generation with lots of headphones on their ears the whole time, I think it's quite a concern, the volume that they listen to sound and music to on their headphones. So there is like a 60-60 listening guideline as well that's very helpful to kind of tell parents to remind their children to keep their volume at 50 to 60% for about an hour a day. Then it's still safe, and it won't cause permanent hearing changes. But if you are talking to a child with headphones on and they can't hear you, then it means the sound is too loud. So really kind of practicing that safe listening, is also really important.
Okay, so now there's a parent who gave birth to a child and they didn't get the screening because it's not mandatory. What do they do and where do they go?
Mm. Very good question, Ilham. So especially in your community in Elsie's River, there is one of us, there is an audiologist at the Elsie's River Community Health Care Center
Mm-hmm.
that rotates and that comes there, as well as speech therapists. So your first point of call will be to go to the clinic and to request, very specifically request a hearing test. Not just, the sister asking, does a child hear, request an official hearing test. So they can do the hearing screenings at the clinic. And then if they see that they need more specialized testing, then this patient will be referred to Tygerberg Hospital for more diagnostic testing, and then also maybe hearing aid fittings or other technology fittings. But then, fitting technology to a hearing impaired child is just the beginning. But then the early intervention, like speech therapy, occupational therapy, special education support, that will be the next step. And we are so privileged in Cape Town to have wonderful schools, but also early intervention centers for children with hearing loss. And the one is the CHAT Center, the Children Hear and Talk Center at the Coral de Toys School, which is here on the grounds of Tygerberg Hospital. So actually close to you guys, where private and state patients from very early on can have early intervention services by a team of professionals to look after them. So there is help available for you guys. There's support available for parents and families with children with hearing loss. They just need to get help and get into the system.
Yeah, they just need to request. I think the more
Yeah.
requests also done through the clinics, maybe then there will also be backup for why you need it to be mandatory because please go and request it by your local clinic. Marge, how can communities and schools work together to promote hearing care and support for children? Because I was just speaking before you came online, I was speaking about maybe you must, because if something doesn't relate to you or something doesn't affect you, then you most of the time you're very dismissive of it. But if you just have a little empathy and put yourself in that person's shoes, and how would you want to be treated?
Mm.
So, like,
Mm.
what do you have on that? How do you deal with
Mm.
that in schools and in communities? Because children and people can be cruel. So,
Yeah, definitely. So I think first of all, there needs to be more awareness about hearing health, and not just hearing loss, but hearing health in general in our communities and our schools. So our teachers and our students need to be educated, lessons need to be incorporated. We need to raise awareness. Um, Also just the effect of noise exposure, for example, or strategies for protecting hearing. And if you think about a classroom setting, clear communication is so essential for both the teacher and the students. So if they have a difficulty hearing in a classroom, if it's maybe due to noise from the outside or the distance from the speaker, that will also affect the normal hearing children. So kind of hearing care is so important in schools. And then, of course, children with hearing loss will suffer more from that. So what we want to promote is just really fostering a supportive listening environment in classrooms. For example, teachers need to know that they need to reduce background noise. For example, closing windows or doors or using carpets to absorb sound. They need to optimize classroom acoustics for children, like arranging the furniture in such a way that it prevents an echo, etc., or reverberation, making sure all the children can see them line of sight. Encourage active listening in classrooms, for example, encouraging the students to actively engage, with maintaining eye contact or asking questions, providing feedback. Then many teachers nowadays, luckily, we can use visual aids to supplement auditory instructions. So I think all of that is really important. So an overall hearing healthy awareness. But then I think parents and communities and teachers have to be alerted to the signs of hearing loss that they can look out for in specific learners. And that might be, for example, someone that just frequently asks questions or have difficulty following instructions. Maybe they actually seem like they've got ADHD or their attention is poor, but maybe they just really can't hear you. So it's difficult for them to pay attention. Maybe someone that overly relies on eye contact or watching faces. Even children on the sports field that does not know where sound comes from. You need two good hearing ears to know. So that's maybe something to look out for. Or children that turn up the volume on devices, socially withdrawn. Some kids are just so exhausted after a school day due to all that listening effort that they had to put in. So I think knowing the signs of hearing loss is important. And then lastly, Ilhaam, I think we really also advocate that we have to implement regular school-based hearing screening programs as well. So it's good to have newborn hearing screening. But I mean, there's lots of things that can happen in that 6 years before a child then goes to school that can also influence their hearing levels. So there are a few pilot programs as well in the Western Cape where we go and screen grade R children's hearing before they then enter grade 1, which I think is great to also raise awareness and is really important. And then lastly, I think just to foster an environment for inclusion and acceptance of disabilities that we're all important is so crucial for children that have hearing loss, and that's maybe in our schools in our area.
Mm. Marge, I was speaking earlier to my colleague, and then he was reminding me that we had a Miss South Africa that actually has a cochlear implant, Mia, and she was such a wonderful representation and also an eye opener to many people because you think you think you un okay, you don't even think about it if it doesn't affect you. So like she kind of opened up that whole world for
Mm,
for people who have hearing disabilities and for the fact that they can reach their goals in life. So like um when it comes to like the implant itself, what is the cost involved? And like say you can't afford it or I know
mm,
you get those um I don't know if it's a cochlear implant, but I just want you to correct me if I'm wrong, but you get those other ones that you can put into your ears like and then it's not in your like in your brain. Is
mm.
what are the different devices that can be used?
Yeah, sure. So let me just say, yeah, the Mia Leroux was this Miss South Africa last year. That was such a role model, and
Yeah,
for many people with hearing loss, and just to see what she can achieve, and that anything is possible, and even in a beauty standard that we have, she
yeah.
really transformed that. So what an amazing role model.
Mm.
Yeah, we all love her.
We do.
So yeah. So in terms of different technology options that's available for people with hearing loss, there's different ones. I think you referred to the hearing aids. So for
Yeah.
people with mild or moderate hearing losses, they can wear a device behind their ear with a battery that will pick up sound and amplify it. And
Okay.
then there's a plastic part in their ear that sends it in. So it sends this amplified signal to your hearing organ, and you can hear well. But then for other people, maybe they don't have the outside part of their ear, or they have chronic ear infections. They can't put something plastic in their ear.
Hi guys. Oh, we're back. I think I lost you for
We
a
are back.
second.
We are back. We are back.
Okay.
It was just when I was about to talk about the wireless sending of sound, and we had a breakdown. So, if a teacher wears that microphone, it also overcomes that distance from the student, the background noise. So it's very helpful to also have that. And then, I mean, nowadays, Ilham, even using apps like speech to text conversions for people with hearing loss, even if they're going to a shop, they can just have that app on their phone. And if someone talks, it will plot the text so they can read what someone is saying, which is very helpful. Or something like closed captions is amazing. And then I think we shouldn't forget about the deaf community that uses South African Sign Language.
Mhm.
And it's often so hard for parents if their child needs to now learn sign language because they don't know this language. So there's also an incredible app called SASL, which is the South African Sign Language Definition, so DEA definition app. And it allows you to just search for a certain word and we'll show you by video what the sign for it is. So technology is really incredible. And we definitely utilize that in the hearing care world.
Marge, where can people go for support? Because normally, like, if somebody ever has a problem and they need support, then they go to support groups. Are there hearing support groups? And like, where can they go?
Mm. Yeah, it's a very good question. So, I would say there's not a lot of peer-to-peer support groups at the moment running, but it's a big need.
Mm.
So, in our cochlear implant unit, we have a teenager support group, and at Carl de Toy School and the Chat Center, they also have support groups for parents of children with hearing loss. So, I really think you should talk to your team, your therapy team, and your audiologist about what is available and what is available maybe in your community. There's also online support available. And, if there's a need in a certain community and there are a few people, it's also great for people to start advocating for themselves and starting these support groups as well in their own communities. So we know often more advanced medical care is necessary, and maybe psychology, referrals, or social workers, family support workers are necessary. So all of that is available. But I think the best is to work through your therapy team or your audiologist.
Okay, so me is like, where I have proper hearing. What can I do to accommodate somebody? Just like small tips that you can give, that you
Mm,
would normally give parents for when they're raising a child and they're
mm.
aware of this. Like, but what can I also do if I come across someone like that? And what tips do you have that I can be more kind and accommodating to the next person?
Yeah, Ilham, it's such a good question. I think we always think with people with hearing loss or deafness that we have to speak louder, but that is not the case. The technology is already making things loud.
Hmm.
But speaking a little, is just speaking in your natural tone of voice, your normal volume, is good enough. But then just speaking a little bit slower gives them, like I'm doing now, gives them time just to process what you're saying. And often, if you see that they're missing something, not just repeating the phrase, the same phrase over and over, maybe thinking of a different word or phrasing it differently, will maybe be easier for them. And then I think making sure that they can see your lips, and good lighting, even for example, is very good. And then the biggest enemy of any person with hearing loss is background noise. So if you are, for example, standing in a room where there is a radio on or a TV on, just move away from that noise source, because to decipher your voice and all the surrounding background noise is very difficult. So I think, yeah, speaking naturally but a bit slower, not a lot of noise, and that they can see your face is often very helpful.
And Marge, when it comes to diet, are there any special foods that people can eat that you can maybe like that helps with hearing or helps with like there's foods for everything, but is there any like any diet that you can dietary needs that you can accommodate them with?
Such an interesting question, Ilham. Not specifically for hearing loss, but I know, the tinnitus, that ringing sensation in the ear that some people have. There is some research that say if you take more caffeine or you eat
Oh.
more spicy foods, that can maybe make that worse. But I think it's also related to your stress levels and your anxiety levels. So for that, I know that's maybe something that you can avoid. But just a general healthy, balanced diet is also good for the ears.
That's so good for the ears. Thank you so much for taking your time and out of your busy schedule to talk to us about this important topic. Is there any last message that you have for people out there just to bring more awareness on this topic and to make them care more?
Yeah, thank you, Ilham. I think Helen Keller said that not having sight cuts you off from from things, but having a hearing loss really isolates you in terms of people because it's so in with communication is so central to hearing loss. So I think if we can keep that in mind and know that communication is such a basic human right, we have to then fight to identify children early. So the earlier the better. And we have to include individuals with hearing loss in our communities. We have to stand up against bullying, and we have to know that there is support available for parents and adults and children. Reach out and go to your clinic and demand a hearing test. I think that's just
Demanded so that we can get it mandatory for all children just to improve our quality of life because the deaf community is a very big part of our life because I mean if you watch the news then you see those people in the corners there. So people that are deaf watch the news and they watch TV and they should be included in every aspect of our daily life also. Maybe next time we can get somebody that has a hearing disability and to come talk to us about their experience so that we can have first-hand experience about
mm.
their experience in life and about their journey and about their struggles and their challenges. So I don't know, I'll speak to you again about that because that would be such a nice thing for people to also be able to relate to somebody because it's always the unrelatable things that get passed over. But I'd like to thank our guest. Her name is Marge Van Dyk. She is the Chief Audiologist at Tygerberg Cochlear Implant Unit. It is World Hearing Day on the 3rd of March, and that is coming up. And the theme this year is from communities to classrooms, hearing care for all children. It is also today is International Cochlear Implant Day.